I'm Jerry Purvis for StarHerald.com, and welcome to another edition of Table Talk. With the coronavirus in the news this time of year, my guest today is Paulette Schnell, the director of the Scottsbluff County Health Department. Thanks for joining us this morning, Paulette.
Glad to be here.
First of all, tell us about this COVID-19 virus, and for individuals on the individual level, what can people do to minimize the risk of spreading the virus?
Well, the difference between the influenza and coronavirus, which is a lot of people say, isn't it just like the flu? This is a new kind of virus that we have not seen before. So some of the things that we assume we know about other viruses, we don't know about this one. So we're learning, and we've come a long ways as it's been out there a little while in other countries. But what we do know is that there's a lot of things we can do personally on an individual level to protect ourselves. And they sometimes sound so easy that you think, well, maybe there should be more I'd be doing, but they're basic things. We want to wash our hands. And I'm not talking about sticking them under the faucet for a couple seconds and drying them off, but really a good 20 seconds of using warm water and soap and washing your hands and doing all the levels in between your fingers and surfaces. Otherwise, you want to be using your antibacterial different kinds of materials that you have to use in your hands. The other thing that you want to look at is not touching your face. Because once you have that on your hands, if you've touched the surface, whether it's flu or COVID, and you go up to your face, you're giving your body a chance to have that virus come in. So you always want to just touch your face less. And we do it all the time. So you stop and think about how you need to stop from doing that and how much you do it on a regular basis. The other thing is, if you do have to, using the back of your hand is much more likely not to have come in contact with other surfaces than the palm of your hand. The other things you want to think about is 6 feet apart. If you can't wear a mask if you're sick, or you can't be around, if you're around somebody that's sick and they're not wearing a mask, if they cough and you see those droplets coming through, you can make sure you're 6 feet apart, because those droplets probably are not going to make it that far. So by having that distance from them, you yourself, if you're healthy, putting a mask on really isn't going to help, because it's not made, those that you can buy across the counter aren't really made to protect from that virus coming in. What it does is, if the person that's coughing puts it on, it keeps them from spreading those droplets out to other people.
Okay, so have there been any positive cases identified in the local area so far?
So far not. We've done testing. They've all come back negative. And so in the panhandle of Nebraska, we have no positives at this point. That can change on a daily basis, because there is testing being done across the panhandle. On pretty much daily basis, there's tests being sent into the state lab. But at this point, they're all back and from yesterday, and they're negative at this point.
So if you think you've contracted the virus and are showing some of the symptoms, what's the next step?
Well, the first thing we want you to think about is there's a cold, which is usually that runny nose, sore throat, kind of congestion. And that's different from when we talk about the shortness of breath and the respiratory problems in this COVID-19. It is more, you're going to have a fever, and you're going to have that cough, and then we're really talking about more of a lower respiratory. So if it's that common cold symptoms, that's really not what we're looking for. But if you have those symptoms, or any symptoms that you're really concerned about, or just wanting information about it, we would encourage you to call. We have the number here in Scottsbluff County at 308-630-1580 that you can call and get information, or if you're wanting or concerned about symptoms that you want to talk to a nurse, we would do that. Otherwise, we would encourage you to, if you think that you might want to go to the doctor, call ahead. We don't want you to show up without preparation, because if you do have COVID-19, we don't want to take the chance of exposing others.
So what are the best practices if, for those who self-quarantine, they think they might have it and stay at home? How do they handle that?
Well, one of the things we'd encourage, take your temperature twice a day, because usually that is going to be one of our first symptoms that you see. And we talk about a temperature being 100.4 or above. So those lower grade temperatures usually aren't that symptom of that. But if you've had some contact or traveled, and we are seeing a community spread in eastern Nebraska and in Colorado now, and of course those other states of California, New York, and Washington, those, when you've been traveling, we're asking you to kind of take that in consideration, staying home and taking that temperature, staying away from others, even if there's others in the home that didn't travel with you, kind of separating out your closeness to them so that you can kind of protect them also. But get some rest, monitor your temperature. If you start having those symptoms, call that number and or your local doctor and run that by them and see if you need to come in if you start to feel worse. If you're not feeling too bad but might be concerned about the symptoms, what you need to think is, if I can stay home and this is kind of feeling like a mild case, that I'm not feeling like the shortness of breath or the high temperature is going to interfere with me being able to just rest and take care of myself at home, think about staying put and not going to the doctor if there's not an antibiotic they can give you. There's not a vaccine that we have yet. So just taking care of yourself, staying hydrated, taking care of your temperature with Tylenol or something to keep it down are things you could do. But we definitely want you to call if you ever have questions regarding those.
One of the terms you mentioned, the community spread. What exactly is that, and how does that factor into the diagnosis?
So community spread changes things. A lot of places have had where they are tracking people who've come into the community that have traveled, or people who will say, I was in some place like Denver and I got notified that I was in direct contact that someone that was positive. When you have community spread, it's someone that shows up, we get tested, they're positive, and they don't know where they got it. They didn't travel, they weren't in close contact with anybody that they know were positive, and so they've been in the community that we're talking about, and they have a case. Because then you know that it was probably picked up from somebody else in the community, and then that's what they call community spread. And that's where we get much more aggressive with the things like the governor talked about they're implementing in Omaha right now, where they're really talking about restaurants need to be looking at drive-through or takeout, public gatherings less than 10, those kinds of things to really start separating people out.
Okay, so those are some of the things that that businesses are doing once community spread is identified.
Right, and in the Panhandle, we haven't had any cases yet, which we've been very good about with the schools doing what they've done, where they've been released in the colleges for watching for the couple of weeks with spring break and taking those measures. I think has really helped us be ahead of the curve. So we're really trying to protect our community in different ways. And so when that one case does happen, whether it be community spread or travel or others, we want to be continuing to do what we're doing, only it'll probably take on another level.
Then school closures, I mean, all of them in the Panhandle closed at the beginning of the week. Is this kind of a preventative measure, and did they have this in place ahead of time in case something like this happened?
The schools have been one of the best prepared when it came to planning for the COVID-19 and how they would deal with this as it moved forward. And what we saw in the group of superintendents across the Panhandle deciding what was best for our whole community was something to be admired, because you hear other stories of other places in the nation where they can't get the people to agree, and so one town does something and then another town doesn't, and so to see them all agree and come, and they have been meeting for a long time, and they've had great plans in place, so they were ready to go. What happened though is on Sunday it was a late decision because of some things that came out from the governor, but that they reacted so quickly before we brought everybody back and got them into a place from spring breaks or travel and those kinds of things was a good thing. Unfortunately, it was a little later on a Sunday evening when we got the notice from the governor, but that they reacted so quickly is a testament to how organized they were and ready to respond.
Okay. So has there been a shortage of resources so far in this local area, and things like test kits or other needed resources you have?
Yeah, so some people are really wondering why we can't just open the doors and have everybody get a test that would like to have one. That's a question I get asked quite frequently because they see other countries or maybe bigger cities maybe being more aggressive with opening up the commercial testing. But what we have to realize is in the community here, the hospitals or the clinics that would gather those have to use the nasal swab that they use to collect flu. So we've been using a lot of our supplies already. It's been a very busy flu season. And then there's a certain culture medium that they put that in, and we only have so many of those. And not that it's a shortage at this point, but if you open the doors to have everybody get tested, and even though you have commercial labs that you can send off, then we run our supply short, not just the physical supply of that, but also the human resources of everyone gathering those swabs and the lab running them to get them set off. And so trying to conserve that is one of the things that our area hospitals are really looking at and working with to do. So we work with the state of Nebraska. They have some very strict guidelines on who they are taking the test for. Those are people with direct contact that have symptoms. And when I say direct contact to a positive case somewhere else, and then they've come and they're presenting with some symptoms, we've been testing them. People who have traveled and also have some symptoms, we've been testing them. And then anybody that's ended up in the hospital and have pneumonia and are progressively getting worse, we want to test them too to make sure that it's not that. So we're trying to save it for those people and healthcare workers maybe that are getting symptomatic, testing them to make sure that they're not that. So there's some very specific priorities there that we're looking at. And so we're really trying to conserve our resources as a community so we can collect those tests to send off to the different labs. So it's not just about the kits or the test, but also the supplies to do the test.
Okay. What are some of the municipalities doing, like the county, local governments, to help prevent the spread of COVID-19?
Well, I think a lot of them are trying to take a look at what are they doing to have gatherings. That's kind of new. That just came out because before it was 50 that we were kind of talking, and it kind of came down to 20, and now they're really wanting, the governor really talking about 10, and so the president was too in his. So really trying to take a look at how do we separate out the meetings that government may be having, board meetings and commissioner meetings and all those. So that's something that they'll definitely be taking a look at, trying to see how they can still hold their meetings that they need to, but that the public has access. So I look that they will be putting those words out. Also, some places they've been looking at limiting how they have access face-to-face with, like the county or the city offices with their workers, and that's a statewide, nationwide look. So there's a lot of services online, but there's some services they're going to have to figure out how that looks like, and that is being talked about and discussed, I think, in all of our different communities when it comes to the government offices.
So if we get one of these outbreaks, what can people do to help others in the community and also their local businesses to help get through this period?
So one thing, and I shared this with the commissioners when I met with them, was we have a great community and a lot of very supportive people, but I know there's some fear out there. But what I would hope is when people are asked to be quarantined, or as we get maybe some more people that are having to stay home, and especially our elderly people, the people over 65 and those people with health problems that are younger, are being the ones that are hit hardest. They're the ones that have more of a chance of being hospitalized and actually dying from this. So we want to take really good care of our community. And we all have loved ones that are probably within those age range or have those problems. So by the long-term care facilities have closed to visitors, or asking those people that are kind of in those age ranges that are hard for them to get out to stay home and stay protected, maybe having that neighbor step up to bring the food to them, offering to help with supplies, and you don't have to interact, you can bring it to the door, but just being that extra person to help those people that are having to stay in, and encourage them by calling them, because it isn't very fun not to be able to get out and to go out to eat and do different things, but by just we still have that great technology where we can reach out and encourage one another and be the kind of people that we've always been in the Panhandle, and just stepping up and take care of our neighbor. I think that's one of the best things we can do. One of the things that I heard that mentioned before, which I thought was a great idea, was if you have a restaurant or a local business that's going to be struggling with this, if you can buy a gift card knowing that you can use it later down the road in a few months, that gives them the money to use now, knowing that we can come back and utilize it at a later time. Might help some of those businesses a little bit. It was something I heard that I just thought was a very kind gesture to think about, and I think that's what we're going to really need, and to do our best response to this is for our community to be what they have been usually, and very kind and gracious to one another.
Okay, like all viruses so far, they burn themselves out over time. So has there been any data so far as to, they speculate as to when this might get better?
Well, in President Trump's announcement yesterday, he talked about July or August before we see the upturn of things. And I've heard that kind of fits with what we're seeing in China. We're seeing people getting back to the factories and some of that being done. So I hate to think it's that long, but a lot of the things that they're asking us to do is in a 6 to 8 week look when it comes to the government asking us to take a look, not that the schools are going to close right now for that much, but taking a look like at 2 weeks reevaluating and going down the line, but really looking out maybe that 6 week to 8 week turnaround before we see something that might ease up.
So what are the problems you run into with overreaction to the pandemic?
People are scared, and this is something that, is once in a lifetime reaction. We had H1N1, but it never reached quite, and I was around as a nurse in this role as public health anyway, in our community, and this is, we closed schools and we asked people to stay home from church and some things, but I think this is a worldwide epidemic and pandemic, and there's a lot of fear, and so I think a lot of overreaction to different things out there and not understanding what you can do to protect yourself, overreaction to being kind to one another, and again I just can't emphasize that out of fear we can't hoard everything. I guess that's one of the most overreactions I've seen is hoarding toilet paper, some of those things that then the people that might have a harder time getting into the stores to buy, whether they have a disability or older and harder to get around, are having a harder time getting supplies. So I think that's been the most overreaction that we've dealt with.
Okay, so can you tell us again that number to go to find out the latest information or go online to find out more?
Yes, for Scottsbluff County, we have 308-630-1580. And then there is a public health, Panhandle Public Health number, and I don't have that.
Yeah.
I'll give it to you.
But they're online as well.
They're online as well too.
Okay.
The other thing just to point out is there's great resources for people to stay up to date, because things are changing so quickly that even as we're talking, some things might change as far as numbers and those kinds of things. The cdc.gov is what is the most accurate and up-to-date place to go. And so I'd encourage people to check in on that if they're wanting to know the most accurate information for the right now moment.
When we talked with the chief medical officer at the hospital, he said, most of all, don't panic. So is that the advice you'd give, or what's the best advice you would give as we go through this?
That's true. My little saying that I did some trainings, different places, is be calm and wash your hands, because that washing your hands is going to be the most protective thing an individual probably can do for themselves is wash your hands, and then being calm about it. So be calm and wash your hands.
Okay. Thank you for joining us today, Paulette.
Thank you.
You've been listening to Table Talk, and I'm Jerry Purvis for StarHerald.com.